Coming up next from segment 7, moving on to the search for eternal youth. Go figure how we put these babies together. A Botox party next on Newsnight. Consider this. Someday you may have to explain to your grandkids what wrinkles were. Really, you'll say, people used to get these cracks and lines in their faces as they got older, and their skin would sort of sag and go soft, and they'd get kind of crinkly and mushy. And the little ones will be silent, and they'll look at you, and then they'll laugh, and they'll say, nah, you're kidding. Well, maybe I am, and maybe I'm not. Come along now to a party organized, to be fair about this, by a woman who is a publicist for a doctor you will also meet. And the guest of honor is a substance the FDA approved for cosmetic use just Monday. Oh, welcome, brave new world.
Hi, everyone. Welcome.
This is what's called a Botox Party. It's basically a situation where people can find out about Botox as a treatment. They can meet me and meet my staff. And if they want to have Botox injections, they can have Botox injections. Most people know that it's a Botox party. We find that we have people who come in and they don't really know even what a Botox party is, so they're here for, you know, an hors d'oeuvre or a cocktail.
I honestly feel that these Botox parties are sort of the Tupperware party of the new millennium, but with a cautionary aspect.
Welcome, everybody. I hope everyone's comfortable, and I think there's going to be some no, please. I think there are going to be some other people struggling in, but I just want to talk a little bit about the procedure because I'm kind of very serious about this stuff. And what we generally do is we give a little talk, just explaining what Botox is, what it can treat, what it can't treat. I know some of you have already had Botox, and some of you are already patients of ours, but Botox is botulinum toxin, which is a deadly toxin that if you inject, if you swallow it in large doses, can kill you. Botox, however, is very safe in the way we administer it, which is in very tiny injections to paralyze areas of muscle.
How much is too much? Can I have my forehead co-seating?
You can never get enough. I think patients really appreciate the fact that that the whole atmosphere is less medical and that they can have a drink afterwards. But it's really the same equipment, the same stuff that we bring, the same level of sterility. We bring ice with us, we bring alcohol pads, we bring needles, we bring everything that's necessary. Don's having it first, right? Yeah. When the patient comes in, I'll usually discuss with them exactly their desires and explain to them what can and can't be done. We usually put some ice on them and keep it for a couple of minutes. Hello there, how are you? Hello. Okay. You all take a series of injections, which usually lasts about a minute, and that's pretty much it. Then they can go back and have a drink or do whatever they do. See you right outside. Then you can have your glass of wine.
Yeah, now I see what you mean.
Botox, actually, amazingly, given that it's one of the most toxic things you can inject into your body and can kill you, is incredibly safe when used properly. The dangers of Botox are mostly local side effects from the procedure. For instance, redness, you can get some bruising. In the area that gets paralyzed, if it migrates to a different area, you can get some drooping of the lid.
I tell myself I can do it when your face is frozen. I can't move anything, so I guess it's working. I couldn't do it.
Can you try to raise your eyebrows for us?
I have fun.
We're definitely used to stuff, but we're also in different times now. It's not just that we're cosmetically oriented, it's that we're competitive.
I'm very, extremely vain. In the entertainment field, you kind of have to be comes with the territory.
This was my first Botox party, but judging from the success of this one, we would certainly do it again because absolutely the demand is there.
I'm going to tell all my friends, my clients. I'm going to tell everyone. My mom, but my mom's not like me. She's going to grow old gracefully.
She won't do it.
No, but I'll fight every inch of the way, though.
I look a little different tonight, don't I? We'll see you tomorrow. Good night for Newsnight.